Hello, welcome back to Constitutional Drug Series. This is Dr. Gayatri, BHMS and REBT counselor. Today we are going to study Medorrhinum. Let's start with the physical appearance. Medorrhinum can be given in both females as well as male, and they are usually obese, fat. There is a short neck, angle of neck and shoulder. It is not seen, not visible at all. They are thick and bold in look. Their face is broad. There is darkish hue under the eyes, a dark blackish hue under the eyes. Open temperament. They are usually extroverts, and angular features are present. Even Philip Bailey mentions that Medorrhinum is equally common amongst men and women. Also, there is history of infections such as UTI or any sexual disturbances. So, past history of that marks indication of Medorrhinum. Usually present and given in dark complexion, rarely fair complexion. It is a nosode, so it can be given as intercurrent too, and mostly can be given for chronic complaints and as a constitutional. We'll now go to the boric first paragraph. A powerful deep acting medicine often indicated for chronic ailments due to suppressed gonorrhea. For women with chronic pelvic disorders, chronic rheumatism, great disturbance and irritability of nervous system, pains intolerable, nerves tingle and quiver, children dwarfed and stunted. Height of the even adult personality is also short. Medorrhinum patients, they are short heighted. Chronic catarrhal conditions in children as well as in adults: nose dirty, tonsils enlarged, thick yellow mucus from nostrils, lips are thick, as I mentioned earlier, thick face, thick tongue. It is also given for enlarged adenoids. So enlarged adenoids, enlarged tonsils, recurrent respiratory infections in children as well as in adults, we can think of giving Medorrhinum. State of collapse and trembling is, as it is a psychotic drug, so history of psychosis or any kind of infection in past often restores a gonorrheal discharge, edema of limbs, disseminated sclerosis. We'll now go to mind. Weak memory, loses thread of conversation, time passes too slowly, cannot speak without weeping, always in a hurry, hopeless of recovery, difficulty in concentration, fears of going insane, even fear of dark. So this is a characteristic confirmatory symptom: fears of dark, fear of being alone, melancholy with suicidal thoughts. A very good remedy for hair fall and dandruff. Hairs are dry, crispy, itching of scalp, dandruff present, headache from jarring of cars, exhaustion or hard work. Eyes feels as if she stared at everything. Eyeballs ache, feels as if sticks in eyes, and lid irritation. Ear complaints, quick darting pains in ear, and deafness. Nose complaints, chronic nasal and pharyngeal catarrhs. So any kind of catarrhs, any kind of recurrence of upper respiratory tract, we can think of giving Medorrhinum. Medorrhinum patient, one other characteristic is he sleeps on his abdomen like that of pulsatilla, and he is better with complaints of respiratory tract or abdominal colic, etc. The complaints are better by sleeping on abdomen. So this is confirmatory symptom of Medorrhinum. So if you think that patient look wise is Medorrhinum, then you can ask and confirm whether what he answers to this question, whether he sleeps on his abdomen and feels better, or what is the sleeping position, like that. Face pallor, acne, small boils break out during menses, tongue is coated, thick and brown, blisters present, stomach ravenous hunger soon after eating. So he is very hungry and very thirsty. Craving for liquor, salt, sweets, warm drinks like lycopodium. He craves for sweets, he craves for warm drinks. Also craving is there for salt. Abdomen rests more comfortably lying on abdomen, as I just mentioned earlier. Violent pain in liver region and spleen region. Stool can pass stool only by leaning very far back. Painful lump sensation, intense itching of anus. Urine, nocturnal enuresis, renal colic, painful tenesmus while urinating. Urine flows very slowly. Intense pruritus in female complaints, that is vaginal itching or so. Menses offensive, profuse, dark and clotted. Stains and difficult to wash out. And to confirm that, you can ask the question that there is frequency of urination during menstruation. So if अगर आपके कोई क्लिनिक में फीमेल कंप्लेंट्स पेशेंट लेके आए PCOD और एनी इरेगुलरिटी डिस्मेनोरिया, देन आप कंफर्म कर सकते हो कि यूरिनेशन ज़्यादा होता है क्या, फ्रिक्वेंटली होता है क्या मेंस्ट्रुएशन के दौरान. सो अगर हाँ बोले तो इमीडिएटली थिंक ऑफ गिविंग मेडोरिनम. सो दिस इज़ वेरी पेक्यूलियर सिम्टम ऑफ मेडोरिनम. सेंसिटिव स्पॉट्स नियर ऑस यूटेराई, ल्यूकोरिया, थिन acrid excoriating fishy odor, psychotic warts on genitals, ovarian pain, worse left side from ovary to ovary, sterility, metrorrhagia. Even we can think of giving it in infertility cases. Nocturnal emissions in male, weakness, impotency, urethritis, painful prostate with frequent urging and painful urination. So अगर कोई enlarged prostate का patient आए and you have tried all other drugs, clematis erecta, sabalserulita, thuja, and anything is not working, or it is sticking in between, then as a intercurrent or psychotic background, you can confirm it with the patient and give Medorrhinum. Respiratory complaints, much oppression of breathing, hoarse voice while reading, dry nightly cough, asthma, larynx feel sore, dyspnea, cannot exhale. This symptom is seen in Sambucus also. And cough is better by lying on stomach. Even every complaints, they are better by lying on stomach. This is very characteristic of Medorrhinum. How to differentiate it from pulsatilla? Medorrhinum is thirsty and pulsatilla is thirstless. Okay, this is the way to differentiate. Extremities, pain in back with burning heat, legs heavy, ache all night, cannot keep them still. Ankles easily turn when walking, burning of hands and feet like that of sulfur. So even Medorrhinum patient keeps feet outside of covering like that of sulfur. Okay. Finger joints are enlarged, puffy, gouty congregations. Heels are tender, soreness of soles and restless. Much more important remedy for skin complaints, eczema, psoriasis, and lot more. Abnormal growths too. Copper colored spots are there, itching intense, and there is a red rash about anus in babies. Newly born babies, they suffer from this kind of rashes in their early life. So we can think of giving them Medorrhinum. Not usually given for fever complaints, so we'll skip that part. Sleep dreams that she is drinking water or any kind of drink, so dreams as if she is drinking. Sleeps in knee chest position. This is one of the characteristic position, but you will not get it in every patient, so little tricky to confirm, but yeah, this is one of the keynote symptom. Sleeps in knee chest position. Modalities: worse when thinking of ailment from daylight to sunset, like that of nitromure. Better in seashore, lying on stomach, and in damp weather the Medorrhinum patient is better. So this is one of the important nosode we have seen today. Short neck, bald, thick tongue, thick face, then appearance wise obese patient, both female and male, psychotic background. Discharges are offensive. Complaints are better by lying on stomach, and sleep position usually knee chest, also sleeps on abdomen. Thirsty patient, can be given in PCOD, infertility, glandular complaints, and impotency also. Recurrent URTI complaints, acute respiratory disease in children, where you can confirm it with कि अगर मतलब अगर कोई चाइल्ड एज अ पेशेंट आए तो यू कैन कंफर्म दैट उसके फादर और मदर को एनी हिस्ट्री ऑफ यूटीआई इन्फेक्शंस रहा है क्या. So on that basis also you can think of giving Medorrhinum to the child. Okay, so this is another important symptoms. Warts are also present. Warts and moles are also present over the neck. Can be given for skin complaints also. Tumors, abnormal growths, rashes and itching.